Love pickleball? Here are the 5 injuries I treat most often, so you know exactly what's happening if you feel that pop, pinch, or ache. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I help people stay mobile with evidence-based non-surgical care. Today we're unpacking the 5 most common pickleball injuries that I see, with clear explanations of what each injury is, why it happens, and how it usually shows up. The ankle tops our list. Quick side steps and abrupt stops overstretch the outer ankle ligaments, especially the anterior talofibular ligament and the calcaneofibular ligament. Players will feel a sharp roll, sometimes hear a pop, and swelling balloons over a few hours. Mild sprains generally settle in 2 to 4 weeks, but more significant injuries can leave the joint wobbly or unstable for months. Repeated strains stretch those rubber band ligaments further, creating chronic instability that accelerates cartilage wear and sets the stage for early arthritis. Next is that burning spot on the outside of the elbow, lateral epicondylitis. Repetitive backhand flicks create microscopic tears where the wrist extensor tendons attach into the bone. Pain starts as a dull ache after play, then turns sharp when you lift a coffee mug or twist a doorknob. Ultrasound will show a thick, frayed tendon. Less true inflammation, but more degeneration. Left alone, fibers can calcify or partially detach, spreading stress into the shoulder and the neck. Moving up, we reach the shoulder's rotator cuff. There's a quartet of small stabilizer muscles. Overhead lobs and high volleys will overload them. Early on, there's nighttime ache on the side of the shoulder. Reaching behind your back triggers a pinch. Imaging will classify the tear as partial or full thickness, but remember, severity is about pain and lost strength, not just what your imaging pictures show alone. Untreated, full thickness tears can retract like a window shade, pulling the joint out of alignment and quickening the arthritic process. Down at the knee, quick lunges to scoop a low dink will twist the joint inward, stressing the medial meniscus and possibly the medial collateral ligament. You might feel or hear a pop, then experience swelling within a day. Joint line tenderness hints at a meniscus tear. A valgus stress test on exam will expose medial collateral ligament laxity. Meniscus tears range from simple splits to complex flaps that can catch and lock the knee. Left unmanaged, they can redistribute load unevenly and speed up cartilage loss. Finally, the lower back. Pickleball's rapid trunk rotation and reaching for low balls batters 2 stabilizers most people ignore: the iliolumbar ligament and the posterior sacroiliac ligaments. The iliolumbar ligament runs like a seatbelt from the pelvis to the lowest lumbar vertebra. Repetitive shear frays it, producing a sharp pain just above the back pocket. The posterior SI or sacroiliac ligaments form a web across the sacroiliac joint. Awkward landings will strain them, causing a deep ache that radiates into the upper glutes. Laxity here lets the pelvis rock unpredictably, forcing back muscles to guard and over time accelerate facet and disc wear. In addition, chronic instability can then also cause pressure against the nerves that come out of the spinal cord, leading to even sciatica symptoms. If you have any of these symptoms and you're a pickleball player, make sure to get checked out by your physician. A good physical examination, an understanding of your musculoskeletal anatomy, and some imaging such as an X-ray, ultrasound, and occasional MRI can help to make a rapid diagnosis. Your first-line treatment option should always be conservative, some activity modification, some physical therapy, and if that's not enough, then consider regenerative medicine treatment option such as platelet-rich plasma, prolotherapy, and bone marrow concentrate stem cells. Pickleball delivers community, cardio, and pure fun, but it also hands players a predictable set of injuries: rolled ankles, throbbing elbows, aching shoulders, clicking knees, and those sneaky lumbar pelvic ligament sprains all follow the same anatomic logic: sudden stops, fast paddles, overhead reaches, twisting lunges, and split-second trunk rotations. When you recognize which structure is likely hurt, ligament versus tendon versus joint, meniscus versus muscle, you're already halfway to the right diagnosis. If any of these descriptions felt uncomfortably familiar, don't wait for pain to dictate your schedule. Early image-guided evaluation pinpoints the exact tissue involved and opens the door to targeted low-risk care. My team here at Chicago Arthritis and Regenerative Medicine is here to translate your scans and your symptoms into a personalized plan that keeps you playing, laughing, and living well for the long haul. If this breakdown helped you understand your aches, give the video a thumbs up, share it with your pickleball crew, and hit subscribe so you never miss an update. For personalized care, visit chicagoarthritis.com. I'm Dr. Siddharth Dambar. Move smarter, stay strong, and live well.